Hello, I'm Dr. Bob Mason, and in this video, I'm going to show you some different approaches that you can take from a natural standpoint on how to help with disc problems in your back. So I'm talking about disc problems, slip discs, disc herniations. It's the intervertebral disc that sits in between the bones of the spine that people have trouble with that causes the pain. And this is the pain that goes down into your back, down into your leg. Sometimes it's going down into your butt. Sometimes it goes to your knee. Sometimes it goes further, causing, massive amounts of pain, sciatica, numbness, tingling can show up, loss of function. You can't move your leg as well as you should. And when it essentially happens, when the discs move and they rupture and they move out of place, if you think, of your spine, your spine is consists of 24 bones that sit one on top of another this way. And what we look for in our office is checking the alignment of the spine. If you have, say a bone like an L4 bone that sits like this, and you have an L5 bone that sits like this, they should be parallel to the ground, not like this. So they should be parallel to the ground. The disc would be the space in between these two bones, which essentially is set up and made of a jelly type of material. So it should be nice and squishy and water-like. And what we look for is if, say, the alignment is altered where this bone moves this way, this bone moves this way, the space in between where the disc is, it starts to spew out. Which way? It's going to go this way. Gravity's going to pull it down this way. The disc slips out. The nerve sits right here. It hits the nerve, and boom, there's your sciatica. There's your pain that's going down into your leg. If it's in your neck, this is the pain that's going down into your arm. So how do we change this? Well, first off, let me show you the medical approach to this. First off, if you went to the orthopedist, went to the back doctor, and they see this, they're going to focus on getting out of pain. And so the medications, the cortisone injections that they do in this area is going to decrease that inflammation. The surgeries that they do, actually, they cut the disc off of the nerve so you don't feel it as much. And it helps, don't get me wrong. I mean, I see people that come in, their pain is like a 10 out of 10. They get the injection, they get the surgery. It alleviates the pain. But ultimately, when that's finished, what is still there? Now, the alignment is still like this because the cortisone injection doesn't correct that. That's what we do. So I don't do medications. We don't prescribe any type of injections, surgeries. Our goal is to change the alignment because a lot of times that's the root cause of where the problem is coming from. So you change that alignment. You keep that disc in a nice neutral position where it's parallel to the ground. It's not spewing out one way or the other. And a lot of times, as long as this problem's not been here long enough, we'll see patients where the disc actually starts to come back in, and that takes care of the pain, on a natural approach. So my advice would be, if you're suffering from this, get this evaluated, find out if the alignment is altered. That's what we do in our office, getting a workup, an exam, checking the nervous system, and then also a series of x-rays will show us what the alignment looks like, and that lets me know if I can help somebody. So if I can, I let you know before we start any treatments what results you would expect to see, how long will it take, what type of time frame in terms of pain and correction. Or if I can't help you and it's too far gone, that's when you need to go see a medical doctor. And unfortunately, that's when you're looking at medication, surgery, and things like that. So hopefully this gives you some more information in terms of different approaches to take. Feel free to check out my website. And if you have any questions in terms of anything like this, feel free to give me a call. I'm always there for phone consultations. Thanks.